What you're going to see today is the journey we've all been on together. Where we were, how we were reacting on March 6th of 2020. Things have changed. We're all wearing masks now. So let's go on this journey together.
We usually say that crazy things happen at 4 o'clock on a Friday. And that's what happened in this case. I believe it was after 5. It was getting dark outside. And we received the call from the state epidemiologist and the director of the lab that, in fact, we had received our first case of COVID-19 in Kentucky. It was in Cynthiana. And within an hour or so, we were over in the governor's office. I hadn't ever been in the governor's office before. And we had our first press conference. That night, I remember driving home in the dark and just had a feeling of, things are going to change.
One of my first memories of the response was walking into the SHOC, the State Health Operations Center, and seeing the preparedness branch, epidemiologists, leadership, everyone sitting around the table, eager and willing to help with the response.
We have faced 3 pandemics, the opioid crisis, COVID-19, and the largest civil rights movement in our history. We have learned a lot. We not only have had a robust, dynamic, creative, and timely response to the pandemics, but we're learning how much better we can be as an agency by working continuously to minimize barriers and to increase access to our services. We have seized the moment and we have harnessed the crisis into opportunities. I could not be any prouder.
During COVID, we supported more than 1,000 AmeriCorps members serving in homeless and domestic violence shelters, senior centers, emergency management offices, health departments, food pantries, state parks, natural spaces, preschools, virtual school, and colleges through virtual training on a multitude of topics.
The Department for Aging and Independent Living came together to serve and protect Kentuckians through COVID-19 by leading with grace and flexibility. We collaborated internally and with community partners to develop and implement creative and innovative ideas to meet the needs of the Commonwealth. Most importantly, we continuously check in on one another and with the individuals that we serve to ask, how are you doing? Because the only way we can get through this is together.
I wanted to share what OIG has been doing to combat the pandemic. First, our Audits and Investigation Division has been working to integrate CASPR within large health systems in order to ensure better patient care, as well as minimize the risk of opioid addiction. Our Health Division, with the help of CON, has created additional licenses for existing facilities in order to ensure that capacity constraints were removed. They've also been working tirelessly on focused infection control surveys in order to mitigate the risk of spread of coronavirus. Our Division of Child Care and Child Placement created an entirely new infrastructure for child care to help with essential workers' children so that they could be taken care of while they were combating the pandemic. I am extremely proud of everyone that works at OIG for all their work during the pandemic to help stop the spread and take care of the most vulnerable in our Commonwealth.
Over the past 12 months, our employees have worked very hard to make sure our members and providers are taken care of during this pandemic. Thanks to their hard work and dedication, we have enrolled over 400,000 new individuals in the program in the last 12 months alone. So today we're serving over 1.6 million Kentuckians in the program. In addition, we expanded the use of telehealth services so that individuals could receive healthcare services in their home safely and comfortably, and providers can get paid for delivering the services. So while this pandemic has definitely caused much heartache and loss and sadness, the Kentucky Department for Medicaid employees continue to be a lifeline for those who need healthcare services, and I thank each and every one of them from the bottom of my heart.
I've worked in early childhood education for 22 years now, and all of those years' experience did not prepare me for the past 11 and a half months. Initially, I anticipated that the closures for childcare would only be a few weeks in order to reduce the spread of the virus. However, we have survived the past 11 and a half months and gone through more than we ever anticipated. Our childcare providers in Kentucky are resilient.
I learned during this pandemic that the entire world can change, and we can still work together to change the world. It doesn't mean that everything is resolved, and it doesn't mean that there isn't still a lot of work for us to do. But it does mean that by collaborating, by facing the difficult challenges that are in front of us, that we can still make a major difference in our lives, in our cabinet, and in our state.
I've been amazed at the wonderful talents and skills and the dedication of everyone in our Department for Public Health family and how hard they've worked to help us overcome this pandemic. I've learned more about ventilation than I ever wanted to know. I've learned about our partners at the Department of Education and how our collaborations will help Kentuckians for years to come. And I've also learned to give myself grace and to give grace to others, and how important that job is for us to give each other grace as we get out of this pandemic and go into our regular daily lives.
When I reflect upon the last 13 months, certain words come to mind: resourceful and resilience. COVID-19 has impacted all of us, some more permanent than others. I'm amazed each day how my team has continued to do their important work, serving the citizens of the Commonwealth with little or no disruption. It also reminds us the importance of what we do, that the needs of those we serve do not go away because of a global event. In fact, their needs only increase, and so must our effort.
We're resilient, Kentucky, and we really are compassionate with our fellow human beings. And what do I want to see us come out of this on the other side as being better, having gone through it, is supporting local businesses and broadening our definition of community. It's more than a street, it's more than your neighborhood, it's more than your county, it's us as a state.
So that's the journey we've been on. That's what we've done together. That's what the governor says. We will get through this, and we will get through this together. We have. We've made a difference together. We know the importance of community. We know how important it is now that whatever happens to one of us in the community happens to us all. These are things that I hope we learn and take out of COVID together. Because we are all in this together. Every Kentuckian. And we've proven that we can care for each other and make a difference. Let's continue to do that. Thank you.